on the dot.
Well, let's go then. There will be some more people coming in. Hey, Sam, if you'll give her a copy of that, that would be excellent.
It's our current land acknowledgement. They did some updates on it.
I have no official duty here whatsoever, but I may be in your face.
We're doing very good.
I was going to say, I don't think it's gonna.
I didn't say all opinion, did I? No, it's not as great as the point like I thought. Oh. And what is happening, guys?
He said we're good for today. I'm just making sure we get updated for next time.
Okay, perfect.
Whether that's, I don't know, whether that's like, hey, Sam, let's do this land acknowledgement.
Just give it a.
Or, no, this is them telling me, this is them telling me I was doing it. It's not up for option. We'll see. Now we're gonna make it option. She's gonna do it. Everyone is perfect. Each and every one of you ladies.
Thank you. Do you want a microphone?
Good afternoon, folks. We're about to get our program started. I'm Sam Flowers. I'm your front house manager here at the Woody Guthrie Center. Before we turn it over to my sister, Miss Jazzy, with our land acknowledgement, I want to let you all know that this is our 10-year anniversary here at the Woody Guthrie Center. This next weekend, from the 5th to the 7th, will be all anniversary 10-year celebration. On the 6th, there is a free day at the Woody Guthrie Center and the Bob Dylan Center, 100% completely free, as well as a concert the entire day on Saturday at the Guthrie Green. We invite each and every one of you out. Just to let you know, there are still tickets available for our Woody Guthrie Prize. The recipient this year is the activist group Pussy Riot. So they will be given the Woody Guthrie Prize at Kane's Ballroom. There are still tickets available. There are membership opportunities. There are promo discounts for the Kane's Pussy Riot show for our members of Bob Dylan Center and the Woody Guthrie Center. So we want to invite each and everyone out next weekend to participate with us for our 10 years here at the Woody Guthrie Center in the downtown Tulsa Art District. I'm going to go ahead and turn it over to my sister Jazzy so she can do the land acknowledgement, and we want to welcome you all to this month's Real Talk. Thank you very much.
Thank you, Sam. Howdy. So to be respectful, we will start with our land acknowledgement, then I'll tell you a little bit more about what we're doing today. So at this time, we'd like to share the Woody Guthrie's land acknowledgement. The Woody Guthrie Center acknowledges the land on which we gather is the home of the Osage, Cherokee, and Muskogee Creek nations, as well as being the ancestral home of the Caddo and numerous other tribes before their forced removal. Their honor and blood inform our spirit and our work. We also acknowledge the Black Americans who lost life, property, and generational wealth in the 1921 massacre. Their honor and blood inform our spirit and our work. And we need a moment of silence after that. All right, thank you. Hello, everyone. My name is Jazzy Bivar Toby, and I am a part of the Tri-City Collective, and I am really happy to welcome you all to Real Talk. I'm not going to tell you a whole bunch about me because I get started talking about me and we'll be here till tomorrow. But what I will tell you is that I identify as several different identities. I am a Black, Latina, queer, adopted, neurodivergent, socially, economically low on the scale. And I am just very glad to be here, a part of this panel. Real Talk Voices the Margins is a series of curated live conversations on issues and topics of critical importance to marginalized communities, including, but not limited to, people of color, LGBTQ plus AI, Two-Spirits, and economically disadvantaged citizens. Providing a voice and platform for often voiceless people is at the heart of this series. Real Talk, Voicing the Margins is a partnership with the Woody Guthrie Center, the Tulsa Artist Fellowship, and the Tri-City Collective. Today, we are covering neurodivergence and women and neurodivergence. Before we get into more of what that means and what that topic, I want to tell you about these wonderful folks sitting up here on this stage. We're going to start in the middle with Amber Joy Thaxton. Amber Joy Thaxton, most of her family calls her Joy. I know her, okay. But if you know her professionally, you most likely know her as Amber. She truly loves both names her mama gave her. Joy is an ambivert and was born in June, so as you can see, she takes a middle approach to most things. Please welcome Joy. All right. And then to her left, we have Anitra Parrish. Anitra Parrish is a social entrepreneur and community advocate with a passion for improving the lives of those with increased barriers to succeed. Anitra has spent decades working on prevention, early education, and public policy, first in Southern California and now in Oklahoma. Welcome, Anitra. And finally, probably the member I've known the most, her name is Kenya Turner Washington. Kenya Turner Washington is a licensed therapist with over 11 years of experience with individuals, couples, and families in Tulsa. Via her own private therapy practice, Kenya's Way, LLC. She received her MSW from the University of Oklahoma and has since been dedicated to helping people improve their mental health and well-being. Washington is a licensed clinical social worker, mental health therapist, a speaker, a poet, a life coach, an author, a wife, and a mom. She also provides training and workshops for corporations, churches, and more. Please welcome Kenya. All right. You're almost done with all of the introductions of what we're doing today. So before we get into the actual panel, I wanted to make sure that we took the opportunity to ground on the topics that we are covering today, both women and neurodivergence, just to make sure that everyone in the room and those virtually had an understanding of where we were coming from. So when it comes to neurodivergence, neurodiversity refers to a variation in neurocognitive functioning. It is an umbrella term that encompasses neurocognitive differences, such as autism, attention deficit hyperactivity disorder, aka ADHD, dyslexia, Tourette syndrome, anxiety, obsessive compulsive disorder, depression, intellectual disability, and schizophrenia, as well as normal neurocognitive functioning, or neurotypality. Neurodivergent individuals are those whose brains function differ from those who are neurologically typical or neurotypical. And I think it was very important to read that, because even being a neurodivergent person, I didn't realize that my dyslexia had me as neurodivergent before my autism spectrum did and my highly sensitive personal condition I have. So wanted to make sure we have that. Also, we want to ground on the definition for women to make sure that everyone in the room understood we are not exclusive. All humans identifying as women, whether genetically, aesthetically, or otherwise, are included in this scope. It is important to note that this inclusive panel is not created with intention of excluding other identities. This information is useful for all, but today we really wanted to hear from a woman's perspective in regards to neurodivergence. So, if y'all are ready, I'm ready. We're about to get into this panel. Let me have a seat. So, we want to start off with all of you kind of answering a little bit about neurodivergence. The first question, very simple, pretty easy for all. Why this topic and why now? Why neurodivergence and why now?
I guess I could take that. I really think it is a time now. I don't know if it's a generational thing. Most of us were raised by baby boomers, and it was very secretive. Things that happened in their lives were kept under the whole veil of secrecy. And growing up in the 80s and 90s, we are now kind of on the cusp of wanting to figure out what's going on with ourselves, that our differences aren't always horrible, defining them, figuring them out, getting medicated if need be, having the support of your family and understanding that it means a lot now. It means a lot to our mental health. It means a lot to just relationship building in families and with strangers and professionally, personally. And I think we're just really sick of being quiet about everything and really wanting to decrease the barriers for ourselves as well as others.
Yeah.
I just wanted to add to that because I think specifically for people of color, we've started to go and get treatment a lot more frequent now. And so being able to have these conversations with providers and say, hey, I'm experiencing this and this is happening, and to get language that goes along with what the experience has been, I think has been something that's allowing us to move the needle forward on this topic, as well as misdiagnosis. As a licensed professional, I have misdiagnosed so many women who have sat in the chair across from me because in our training, we're not trained to see ADHD in adults. I was trained to see it specifically through the lens of a classroom. And so obviously after a certain age, if you're seeing adult clients, that you're more than likely not looking for ADHD, you're looking for anxiety, you're looking for schizophrenia. And to be clear, a diagnosis is just a cluster of experiences, a cluster of symptoms that we say, oh, if you're experiencing these 6, this is what it's called. And there wasn't a box for this. And so I think we're literally creating new boxes right now.
Yeah. I agree with that, and to kind of piggyback off of you guys both, I think now is more of both of what you guys said, but also along with that, social media. Social media is playing such a huge role in pushing this forward and making it be quote unquote normal, because I do not like that word, so acceptable for people to talk about this, because in my practice, that is what I am seeing more and more. I'm getting the emails and the phone calls, and what they're not saying neurodivergent, they're saying, I want to find me. Who am I? And so that's what I'm hearing, and I've lost myself. And so then we kind of figured that out. But a lot of that came from TikTok or from them seeing something on social media or hearing something, and they're like, wait, that's me. Or that's my mom. And so if that's my mom or that's my dad, And so that's why I think now, the conversation is now.
You brought up a really good point about diagnosis. My therapist actually won't do diagnoses for that exact reason. She focuses on passing clients, if they want to get diagnosis, to another. She just focuses on the care part. A lot of the time, historically, neurodivergent people have been excluded from conversations that impact their lives. What impact can that have on the people in this community?
Can you say that one more time?
Sure. A lot of neurodivergent people have historically been excluded from conversations that impact their lives. How can that have an impact on the community? What impact does that have on the community of neurodivergence, or the community at large?
It goes back to, do you have a seat at the table? If we don't have a seat at the table, then what's relevant to those people that is impacting, really that point doesn't get made, that point doesn't get addressed. And so I think now that we have opportunities to share, like, hey, I fit this mold and there's no diagnosis, there's no box for me, then I think it allows us to think outside of the box. One thing, even to your point, you're mentioning that your provider doesn't do diagnosis. In order for most providers to get any type of funding, you have to give someone a label. If you cannot give them a label, their insurance does not want to pay for it. And so that creates a whole nother challenge, because I agree, I typically don't even tell most people like what the box is, because then we get stuck with the label. But for me, it's like, how can we talk about your specific experiences? How can we find solutions and ways to cope with your specific challenges? And so I think that's what it is for me.
Yeah, and it definitely has a lot to do with self-advocacy. I think a lot of us, we get so busy with life and we don't want to take it on, but realize, we advocate for others sometimes, but we don't necessarily advocate for ourselves. And sometimes that's standing up to medical professionals or standing up to a family member that doesn't believe that you have something wrong with you. I complained my whole entire childhood about not feeling a certain way, and I struggled. But having a brother a couple years younger than me, he presented with hyperactivity. So he got medicated, he got the support. I was just a misunderstood, shy, internal, anxiety-riddled child. Yeah. But, that's, it all goes along with just really teaching the new generations to advocate for themselves and making sure that if you don't feel right, get it checked out. I mean, once I was finally medicated, my anxiety and depression lifted so far. I realized then that I knew that day of the first day of medication that I was like, wow, this is a true diagnosis. This is accurate. I don't have to suffer in silence and neglect basically anymore. And just that really push for doing that, the self-advocacy and supporting others as well in your family.
Thank you. Did you have anything, or you?
I think just when you said having a seat at the table and then you start talking about school, I think what's important is that when policies are being made and laws are being made, that this is why we have to have a seat and our voices have to be heard and we have to advocate, because certain laws and things that are being passed in schools and in our legal system, if our voices were heard and we had a seat, things would be hopefully, maybe,
yes,
addressed differently. Yeah. And so we could save lives in several ways. Okay?
Absolutely.
So.
Let's save lives for sure. Historically, statistics have documented that more men have been diagnosed than women. Can you shed light on why that might be the case?
Hey, I think when we are good at masking, we are good at pretending and acting, whatever word you want to attach to that. We're also taught that at a young age. And so, yes, we are going to mimic those around us, whoever is raising us, and we learn quickly, and I'm not saying that males don't. They can get away with not doing certain things that historically women, females, have not been able to get away with doing. And so we learn to adapt a lot quicker. And like I said, we're good at masking and being more social, okay? And so when you're more social and you can adapt, it seems that you are well and everything is okay. That's why. That is one of the reasons, some of the reasons, because there are several.
There are several.
Yes.
There are several. I think we all have something to say. Because, man, it's interesting because we know that this affects all of our brains the same way, but it affects our behaviors differently. And to your point about the masking, because for a little boy who's in the classroom who's all over the place, like, okay, well, he's aggressive or he's too active. And for a little girl, well, she's social or she's being herself or she's a butterfly. She's just, connecting with everyone. And so there's these labels that I think society will put on different individuals that make this same behavior okay, because it's a little less disruptive or it shows up differently. And I don't even want to talk about cycles and menstrual periods, because that is estrogen is such a big factor in how that fluctuates and how it affects ADHD. And so I think for sure we have all said, oh, it's just that time of the month, and if
so much bigger than
it's
that.
more than a week. It's the week before, it's the week after, it's the majority of the month. It's this chemical imbalance that we're facing. And so I think and I learned this during pregnancy, like it's kind of off topic, on topic, but like I had this weird like spot on my back, and they were like, oh, that's just pregnancy. And I felt like I would come in with something new every month, and they're like, that's just pregnancy. And I think that's how it is whenever we have issues in our youth and through our womanhood, or however you identify, like when you're connecting to that, I think that we say, oh, that's just that part of you. And we ignore the fact that, like, no, this is dysfunctional. This is problematic. And I think we easily just dismiss and say, oh, it's just that time of the month, or everybody goes through that.
Or if it's a behavior that's not problematic, we need to pay attention, because that is also why males are diagnosed early, because most of their behaviors are problematic to someone.
Or I think sometimes it's what's outweighing it, because I think we have all heard someone say, oh, I have mom brain. But you still getting the dishes washed, you still getting that baby fed, you're still doing all the things. So you're gonna be all right. Yeah. It's the same thing. It's feeling like you have that brain fog, and I think we've just normalized all those symptoms because we're getting it done. So that outweighs the dysfunction.
Definitely. We've learned from a very young age to ignore those things, and that's, this society gender bias is what brought, girls and boys are raised differently. We are pushing in our new generations, hopefully, about treating those children the same way, giving them the same ability to advance, giving them the same ideas to succeed in specific things. And, myself growing up in the 80s, it was only focused on boys, hyperactivity, because they saw that, as you said, problematic. In girls, they were just talkative, or they were just, bossy, or so it was always giving excuses for the girls' behavior. But boys, it's like, oh, theirs were usually with high egos and being destructive and talkative. But with girls, we present so differently. We present as low self-esteem. We present as complete depression and anxiety. So it's in all these different ways that we were continued to ignore. And statistically, only 25% of ADHD people actually have the hyperactivity component. And that number right there, that's what's all studied about it. So now there's 75% of us that have all these different things that are mostly, cognitive related, and they're being ignored, and they're not being studied, even though they are far outweigh the 25% of hyperactivity.
So this is good, because that leads us right into our next question about intersectionality. So I learned a little bit while I was researching for this panel, but intersectionality has been used to describe the impact of sexism and racism, particularly on women. What is your perspective on the addition of neurodiversity and how that may impact discrimination that women of color face? Yeah, take a moment, breathe.
Man, that's a loaded question. I think about it, my kids are small, so I think a lot through the lens of just being a mother and all of the responsibility that comes with that, as well as the normalizing when we're going through something difficult, all the way back to the delivery room. I remember I first learned about how what was reported by women of color was dismissed more easily, and I was scared to death that something was going to be going wrong during what, labor is traumatic. Like during this traumatic experience, that something beautiful was going to be on the other side, but I knew I had to go through it. I was deathly afraid that what if I felt like something was going to go wrong and somebody wasn't going to listen to me, and someone else is going to have to raise my kids. Like that was such a stressful experience, because I was beginning to just learn about how a lot of the time, like women of color would complain about something, and the doctors or nurses would kind of dismiss it. So I think it goes back even to that point, that a lot of things go underreported because I think they're either misreported or we consider them normalized. And then I think secondly too, because we oftentimes in our culture, Black culture, have learned you don't share it. And so I think that has added a big challenge and barrier as well.
Sure.
As an advocate, we need to listen to Black women. It is a continued a continued thing, that it's just an increased barrier for them all to have to try to overcome. And as a society, it shows we're not paying enough attention. We're not supporting them. We are not decreasing the gaps in all of the access to everything. So as a woman, as a neurodivergent, as a white woman, I want to remind people to listen to other women.
Yeah. Y'all, well, a few of y'all heard my introduction with all of my identities, and being neurodivergent has made it even tougher in corporate America, because I'm now identifying that earlier on in the process to make sure that there is a different way of handling the things that I may bring to the table, or conversations in general, and to put a new face to it. Because when you close your eyes and you think of ADHD, what do you see? Mm-hmm. And so hopefully with us saying it out loud a lot more, that'll make it a lot more possible for other people that don't look like that picture to be able to identify and have a less discriminative area. So let's talk about some stereotypes. I know Anitra has identified as neurodivergent, but what have you experienced in neurodiversity in your work or personally? And if personally, how did it show up as you developed through life?
Me personally, with my lived experience, sometimes it was just all over the place because I didn't know what was wrong with me. There were times where I'm truly an introvert, but I have moments of extroversion, but I feel like that's comes down to maybe the hyperactivity element of it, where sometimes I just know, I'm like, oh, I'm hyper right now, and that shows out in social situations, but causes anxiety. But so it presented. Sometimes it helped me. It helped me be social, but other times it kept me away from doing a lot of things I wanted to do, a lot of places I wanted to go, a lot of things I wanted to say in front of people or advocate for my friends or other people, because of the fear, the anxiety, the not being respected in those ways, because them seeing, I've always been called quirky, you know, like that's
eccentric.
Yes,
you're so
those
different.
are the two words. I was like, well, that's could be worse, but the fact that my brain observes and learns something differently, and hopefully we'll get in the topic of the good things of it. Yeah. There's some amazing things that have actually excelled really far in my career, in my consultancy, and being able to figure things out and create my own processes and things. And that's been kind of, we have to do to survive. But long-winded, any day, every day there's something different. It's whether, how do I feel? Am I going to knock this out? Am I going to go to this meeting, or am I going to just bomb this interview? I mean, bomb, just because something triggers me in my high empathy and inability to really connect with a person. That just makes me distracted and focus on something else. So it's just really trying to just figure things out for yourself and finding out coping mechanisms to try to regulate, or at least prepare yourself for different situations.
I guess it's on me. I don't listen. For Kenya, I'm in the thick of this, okay? And I am on a journey, and I am healing. And I think it started for me with COVID, and I started noticing some things within self, okay, and within my family. And then it dawned on me, oh, I'm different.
I'm that different.
I knew I was different. I've always been different, and I'm okay with that. But I didn't know I was different. And so, and I'm saying that in fun, because when you ask that, there are still things I'm learning about myself, that, yes, I can check off boxes, but then what? And so for Kenya, it is an ongoing journey of me now going back over life and like playing like, oh, this is why I didn't excel in school in this area, but I did in college, okay? And so, because I was horrible in school. I did my best, and for me, that was my best, was C's and some D's. But I now know that it was because of the way my brain worked, but no one around me got that. And that is no disrespect to my mom, I love you, at all, because what you don't know, okay? And so I learned different. I also know I have some sensory things. Listen, I'm a ball of fun. And so now having this discussion with my husband and looking at our 8-year-old, and we're like, yeah, here we are. And so I will say this, he is now having a wonderful experience, my 8-year-old, because I recognize. That's right. And so now he is thriving. He has always thrived academically, but socially now there's some other things that I now, yes. Because as a professional, you can miss it when it's in your home. Yeah. And when it's you, I can see it in everybody else. That's right. And so I've always been different, but now I'm different. And that's okay. That's okay, because I can continue to help those around me. But the stereotypes were, as a kid, that I wasn't attentive. You know, I didn't pay attention. I knew it all. I had a smart mouth. I knew what I knew. And so now when the 8-year-old, and I'm like, well, those are facts. But did you have to say it? And he's like, I did. I had to tell you that because it's facts. And so now we're working that some things don't have to be said. And my husband says, but Kenya, you do. You do the same thing.
First of all, I thank y'all both for your vulnerability there. The term that I'm using for that is called generational progress. Oh, I love it. Now, y'all are all therapists and y'all are all writers. Please feel free to use my term. Just make sure you put Jazzy Bivar Toby there.
And I will.
Because that's the same thing that my family, sorry, I'm looking at my family, and I have experienced. My son and I have experienced. My parenting style is completely different because of the experiences that I've gone through. And being able to say, oh, like I'm fully awake for life now because I know these things about me. When my therapist, this recent one, said you might have highly sensitive person condition, yes, I was like, because my mama, listen, you see her nodding her head over there, I don't even gotta look. That's my sensitive child, absolutely. But I'm also the one that will cut you with words. Yes. And so all of these experiences have helped us to be better parents and better people and better leaders. You're probably not gonna find much better leadership than what I bring to the table because of all of these things. Correct. Did you have something you wanted to contribute?
Well, I was just going to mention quickly what you mentioned about struggles in school, and I think it's really important to kind of address for people or parents that are really interested in the subject that even though we struggled in school, it wasn't because we couldn't understand the content. We most likely, our brains are moving faster. We're understanding the content. We're learning so much, but we have our executive function so different, and we're unable to time control. We're procrastinators. We're unable to, like, I think for me personally, and for a lot of people that I've spoken to with ADHD, that's the issue, because our brain, like, we're told, so many of us, very, interesting, intelligent, all these things. I was like, well, I struggle. I'm such a procrastinator, but I get it done. But now it's like, I've gotten better as an adult sometimes. But yeah, just kind of like on the school thing, like that's where it's so big about figuring that out, so those children, girls, can get a lot more help at that and not have to struggle as much as us.
And even some adults. So kind of segueing to our next question, in corporate America, I was in corporate America for 10 plus years, and I used to hate when they would want to give me recognition, because it's always like, oh, we'll just send Jazzy in there. She's a bull in a china shop. She'll get it done. One called me a not a snake in the grass, but some sort of snake. He called me a hound dog. He was just all over the place. But having those things, those characteristics, that hypervigilance that comes along with my sensitivities, not being the person, because of my dyslexia, I don't read, so I pay a lot more attention to what's coming out of your mouth, and I can almost immediately regurgitate every single thing that you've said. Also with my use of language, like I just said, regurgitate. People get uncomfortable when you start using the language in a different way that it was intended. Sometimes in neurodivergence, we talked about a high sense of empathy. So let's talk a little bit more about that. From your view, what is the connection between empathy and neurodiverse people? Be it women specifically or humans in general, empathy and neurodivergence.
I'm thinking from the perspective of an empath, and I worked with someone who has symptoms of ADHD, so I don't necessarily identify with all of them. Like I said, mine, I feel like came within the beautiful umbrella of motherhood, and so it hasn't been over my lifespan. However, working with someone who didn't present that at the interview for sure, but throughout our time together, whenever she would do something that she felt like was disappointing to me or she missed a task, like it was like game over for her. And I'm thinking like, get it right the next time, like write it down. Like, and for her, because of that empath, like because of that empathy, like she was attaching to what she thought my energy was and thinking that because it disappointed me. And I remember having so many times to communicate like, I don't have a feeling towards you about this. This is a task. Like I care about people and this is a task. Like I feel like we have to figure out what we're going to do with the task, but you and I, we're good. And so I think professionally, how I've experienced this is just being able to be aware of it. And I think over time, when she felt comfortable with me, she was able to tell me like, hey, this is what's going on with me. Here's what I'm doing to work on it. And I knew from that point on, like, okay, I have to be even more patient. I have to be more aware of my own energy because again, when I'm separating it in my mind between task and person, she's lumping all that together. Right. And so I had to be very, I think, considerate of my own energy and dealing with things a different way so I was never projecting that. Because when you're an entrepreneur, like everything's on you. And I'm bringing that to the room. It has nothing to do with you. It's the fact that I got to pay these bills, keep these lights on, and also go see my client in 2 minutes. Right. And so I think as far as like empath and being empathetic, that I think, like you said, we're using different parts of our existence to connect with people to kind of make up the difference. And I think when that's happening as humans, we can all be more sensitive to how to better communicate beyond our words because there is an energy that we all are, exuding.
I personally experience high empathy, and that right there, a lot of people would think, oh, that's wonderful. That's such a wonderful, caring, loving, thing that you have. Yeah. And they don't go beyond what it really truly is and how it feels. I've experienced when I'm around kind, wonderful people that have this specific energy, I do wonderful, I thrive. Yeah. But then put me in that other situation. Put me in somewhere where I'm being judged, where I could read microaggressions like nothing. I pick up on people's just their body language, their behavior. I know instantly if someone wants to be be full of conflict or not. It's a lot of anxiety and stress inducing, and it has kept me from being around situations for sure, or leaving. I've gotten very good at the whole Irish goodbye and actually had to do that just recently in something where I just stood up in a conference and just walked out and was like, this is not for me. I do not feel good right now. This is a bad anxiety feeling. I don't need to experience this right now. And I got up and left. And even though I felt really panicked and anxious, like once I left, I actually texted you, and I was like, I feel better. Like, I'm glad I did that. And friends, fortunately, that understand are like, good for you. And having that means a lot. And I just as we mentioned before, as women, as girls, we're taught to be accommodating to other people, but that in itself takes away from our safety. Like, you hear these stories of like, oh, well, I let him use this and come inside my house because I didn't want to be rude, and then something bad happens. But I mean, that's the far degree of it all. But we allow a lot of things we experience a lot of things that we don't need to put ourselves through out of the fact of trying to be accommodating, and listening to that and trying not to, to understand the empathy and how it works is just very important, and being around people that understand that as well is a big difference, because other people are like, oh, the whole sensitive, or oh, this and that. But fortunately, now that I'm older and very much trying to surround myself around the right kind of people, and have definitely through my life gotten rid of people that were very toxic in my lives, and including family members that unfortunately, but it's liberating, and I'm excited for the next thing, and I get really excited like a child when I meet someone that I really connect with. But quickly, sorry, I talk to women all the time that have ADHD, and majority of them all have the high empath thing. But oddly, boys and men usually have the opposite, which I'm not sure. It's just what I've read through medical journals and different things, that they actually have low empathy because they're especially the ones with the hyperactivity, because they're just impulsive and wanting to do things for themselves. So I find it very interesting that itself is so different for the genders. So that right there, I think is very interesting.
Before y'all answer, I thought it was funny how you say people are like, oh, that must be so great. It's like one of my characters is I have to say what's on my mind. It's not like I have to get it out or my body will shut down. And people are like, I just wish I could come in a room and say things. Do you? Because let me tell you, you don't understand sitting in a room telling yourself, don't say it, don't say it, and how hard that is. I stress with my family and my partner, like, look, I just have to get it out and then I'll be fine. But it's the worst. Yeah. You all, same question, empathy, neurodivergence, or whatever you want to share.
Empathy, I think, hey, my whole life I was called sensitive, and now things are making sense a little bit, okay? I get it. Oh, Kenya's just sensitive. She's about to cry, or she's about to say this. And I wasn't realizing until I've done more research, and again, on this journey of healing and helping my clients, that some of those things, yes, are in us because, what we have going on. But I need people to also be aware that some of that is learned behavior and trauma response too. And so where you had to learn to identify people's feelings and emotions by reading their body language and their facial expressions to save your life or save someone else, whether that was verbal abuse, emotional abuse, whatever. And so then you learn to read people's body language, so that I need to know if I need to go hide, or I need to go be quiet, or tell my siblings, or whatever that is. And so those are things that I work with clients on when they wonder, oh, am I an empath? Does this mean that I'm XYZ? Because again, social media will have you diagnosing yourself. And so with that, I'm just wanted to tap into that part of being an empath as well. And so when people say, oh, it must be nice, be mindful of your words, because you don't know why that person is such an empath, because it could be due to trauma. It may not always be a positive reason why I can read the whole room.
Yes.
And I can walk up to each of you and say, hey, this is what's going on, or that is what's going on.
Amen.
So just be aware of that when you have people that you're interacting with, and you may say, oh, she can feel everything. There's a story around that sometimes, why someone can feel everything. And I'm so proud of you, though, for setting those boundaries, because again, that's what I work with myself and my clients on. It's okay to leave.
Yeah, and I identify with what you have to say. A lot of my stuff does come from childhood trauma that has either made obviously made a lot of difference in my life, but also that I'm working on currently and trying to heal from. And that right there is just, it is. I mean, I have a friend that has a lot of the same issues as or skills. Fabulous personality traits as myself.
I call them
And
superpowers.
it's
I was just about to
superpowers.
say that.
Superpowers in my family.
And she experienced a lot of trauma herself, and I see it through her, and then I start relating it to myself, and sometimes hers is even to the worst degree, and it's all of us trying to figure out how to heal, unfortunately. That it doesn't always come from a bad place, but a lot of the things that, personally, from my experience, has come from having to deal with something that just shouldn't have happened in the first place, and trying to figure
Correct.
out. I mean, even my profession's a fixer. I fix things.
Yes.
I figure out how to improve processes and services, and like that right there is just like my life. It's like I live my life.
Yeah.
My passion is my life, and it's all really rooted into fixing what I experienced as a child of neglect and abuse, and it's just, I don't know. I like to think that now I use it as my superpower, even though it comes from pain, that it is something that I feel like a stronger person, and that I can take on most anything. Things don't scare me. I am not scared easily, and because of the experience in the past, but that, hey, I'm still here, and just kind of, it goes back to surrounding yourself around the people of healing that are not going to be that judgment and negativity. So support your friends, support the
Yes.
people in your lives.
So as we wrap in our questions, I want to give everyone the opportunity to give a closing thought, a word of advice on engaging the neurodiverse community, or how to be aware how neurodiversity may show up in the room, in organizations, so that people can be mindful. Sorry, my eyeball's something in my eye. So that people can be aware of that, so they can handle it in a more mature, inclusive fashion, instead of a must be nice, or a, oh my God, Jazzy, you have to sit in the same seat every single time. How can we be better as humans?
I think it's just in general being mindful of your words. We try to teach that to kids at such a young age, but it gets to a point where, especially now with social media and the trolling and like the unaccountability of what you have to say and how you can abuse someone freely. There's tons and tons of different ways that it stems from, but just be aware of what you say. Like, why is it so difficult to think before you speak? Like, truly think before you speak. Like, does what I have to say to this person add value to our relationship, to our situation, to our whatever situation, whatever meeting we're in, or if it's personal? Does it add value? Are you hurting someone? Or are you saying things that, I understand there's times where you have to take constructive criticism, especially professionally, and that's different, but truly just, it's hard to say kindness, because obviously we live in a world that we have to deal with conflict, but just choose your words and use accountability on yourself to what you decide to say to people.
I want to advocate for just ignorance here for a second.
Okay,
because
let's
yeah, like you mentioned earlier, quirky, and I have said quirky. So in this moment, I'm like, what? That was not a compliment, because you were on my nerves, and that was like the best thing I could have said.
It might have been a compliment. It might have been a compliment. It might have. Yeah.
It's a compliment.
And so, but I think, because I know a lot of times when it comes to like giving advice, especially as a counselor, people don't want advice. People want to hear themselves, and they want you to reflect back what they said in a better way, almost like they just want to hear more of what they have to say. And when they're ready to grow and learn, they'll take what they have and what they can, and they'll put it into practice. So I want to say specifically what I've learned from being on this panel is like how important it is to always be willing to learn. I love when you and I came in the room, we were some of the first people, and we connected over something that was really similar. We were talking about being empath, and when you come early into a space, you kind of get to fill it out for yourself. Right. Because when more people come into the room, like you'll start feeling their energy, and before you know, you're like, am I happy? Am I sad? Am I confused? So we come early so we can be clear on like how we feel.
Am I safe here?
Am I safe here? Like, which defenses do I need to show up with? And so for me, it's important to come with questions because I'm going to say it wrong. I feel like there's always something new to learn. You gave us a new term today. And there's always something that we're going to say that can offend someone. So I love just being able to like always be learning, trying to adapt, and then also asking questions because quirky to you may have been offensive, quirky to someone else may have been different, but now I know like, okay, let me be more aware of that. I'm going to ask like, okay, would you call that quirky? Like, you know, and just being able to like check and get a pulse. Yeah. So that's my advice for myself. And if you can take from that, please do.
Amen.
I think there's just not a one size fits all, and let's just be mindful of that we're all different. I think just be respectful, ask questions, and just there's differences in all of us, and that's okay. That's not a bad thing. That should be a positive thing. Be open. And when I say that is because I hear people so quick to say, oh, that's that new stuff. Y'all always saying, and that's the older generation. But no, it's not. Okay. It's all generations will say that. And so let's be mindful of that. So if you hear someone saying, I'm going to speak in the I, if you hear Kenya saying, okay, he operates differently or he learns differently, because for me, I don't make my kids hug. They don't have to hug, okay? And there's several reasons why I do that, but I can't get into that now. But be respectful if I say he doesn't like hugging or he doesn't have to hug you right now. He will do it when he's ready. He, meaning my 8-year-old at this time, or any kid, my nephews, it doesn't matter who is with me. So that's just an example of us being respectful, because there could be some sensory things going on. No parent or guardian caregiver should have to go in depth at a park, at a family function on why I'm saying, hey, no, you know, or whatever word I use and say, like, let's pause. So that's what I want people to take from this. Be respectful of individuals, whether it's kids or adults, and they kind of pull back a little bit, give them some space, and then circle back to it if need be. So for me, today I learned that we're all different. There is no normal, y'all. None. We are all walking around with stuff. So be respectful of each other.
Wow.
Just funny, really quick, just to touch on the whole eccentric and quirkiness. I read something a while back that really stuck with me, and it was they were talking about two elderly women, and they were both definitely had mental illness. And one was considered mentally ill and one was considered eccentric old lady. What was the difference between the two of them? The eccentric old lady was wealthy. And so that's the difference. They were both mentally ill, but society teaches us that, you know, with the different obviously the biases, the standards, the discrimination of people, the inequities. So I always think about that when I hear the word quirky, and I don't know. It goes back to be aware of your words. Are you experience bias? When you make a comment, think about that. And we all have them, no matter how great we are in equity training and equality training. All of these biases exist, and being very aware of that.
Thank you. So we're now to what I call the Jerry Springer moment of the real talk. I'm going to look directly in the camera. No, I'm just playing. So just to wrap up, I wanted to read this piece from this article. Special shout out to Fern in the back. They did some great research for us, and I thought this piece would be really good to close us out. A neurodiversity perspective stresses that everyone has a different mind, a different way of being, and that we should not suppress these differences, but accept and support them. According to neurodiversity advocates, neurodiversity is a natural and valuable form of human diversity, which should be considered in a similar as many ways to other forms of human diversity, such as racial, sexual, gender, and cultural. Increasing neurodiversity entails accommodating neurocognitive differences and acknowledging, including, amplifying, and celebrating
the valuable perspectives of neurodivergent individuals. And for me personally, my restorative thought, nothing about us without us. If you have a person in your life that has breath, don't make decisions for them without including them. It is important that this conversation is something that we can all grasp from. Inclusive, everyone has an opportunity. I'm a professional inclusive leader, and I still have a lot of opportunities. And I'm thankful for those that give me grace as I may make mistakes through that path. Our special message, if you or someone you know would like more information on neurodiversity, please see a list of our resources posted on our Tri-City Collective Facebook page and our Instagram pages. To access information about autism, please visit the Autistic Women and Non-Binary Network, or AWN, at awnnetwork.org. Please note there's 2 N's. And children and adults with attention deficit hyperactivity disorder, or CHAD, at chad.org. Special thanks again to my good buddy Fern back there. Special thanks to Judy for helping us put all this together, inviting us to be the voices of neurodiversity and today. Also, special thanks to my panelists here, Amber Joy Thaxton, Anitra Parrish, and Kenya Turner Washington. We appreciate really the Real Talk for making this a possibility, Tri-City Collective, the Woody Guthrie Center, and Tulsa Artist Fellowships. Thank you to all that came to visit us personally here in the room, and also for those on the internet. Join us again next month. Real Talk is live every 3rd Saturday right here. Okay. Every other 3rd month. Listen, they didn't have it in the paper, okay? Real Talk is coming. It'll be on Facebook. It'll be on Instagram. We will pass you the information. See you when it happens next. Thank you.